Right now, take off one sock. Just one. Look at the skin where the elastic sat all day. If you can see a clear indentation pressed into your calf, a groove that stays there for 30 seconds, a minute, sometimes 5 minutes before the skin finally smooths back out, I need you to keep watching. Because what you are looking at is not a sock problem. It is not a salt problem. And despite what almost every person over 60 has been told, in the majority of cases, it is not a heart problem either. It is a drainage problem. And the organ responsible is the one nobody ever bothered to explain to you. Welcome to Secure Health. Today, we're going to change what you think you know about swollen ankles and give you a 5-minute nightly routine that can reverse it. The water is already in your leg right now, maybe half a liter, maybe a full liter, pooled quietly in the tissues around your ankle and calf while you sat today. And tonight, when you lie down, that water is going to do something that ruins your sleep, stresses your heart, and accelerates every problem you're already trying to manage. Let me show you exactly what is happening inside that ankle and how to fix it. You know the moment. You come home, peel off your shoes, and there they are. Ankles that look thicker than they did this morning. Calves that feel tight and heavy. Rings that suddenly refuse to come off. You press your thumb into the skin above your ankle bone and watch it leave a small crater that takes forever to fill back in. And when you mention this at a doctor's appointment, what happens? You get asked about your heart. You get told to cut salt. You get a prescription for a diuretic, a water pill that sends you running to the bathroom all day. And for some people, that helps a little. For most people over 60, it does almost nothing. Here's why. The water was never in your bloodstream in the first place. It was in your tissues. And a diuretic cannot reach your tissues. It can only pull water out of your blood. So for years, millions of people have been treating the wrong compartment entirely. Let's fix that right now. Your body has 2 drainage networks, not one. Most people only know about the first, blood. Arteries carry fresh blood out. Veins carry used blood back. That system has a pump, your heart, and it runs automatically every second of your life. The second network is called the lymphatic system, and here's what nobody sat you down and explained. It has no pump. None. Zero. Your lymph is a clear, pale yellow fluid that constantly leaks out of the tiny blood vessels in your tissues. It bathes your cells, picks up cellular waste, dead bacteria, excess protein, and excess water. Then it has to be returned to your bloodstream through a completely separate set of vessels, lymph capillaries and lymph ducts, roughly 2 liters of it every single day. But those lymph vessels have no heart attached to them. They move only when you move. Think of your lymphatic system as a conveyor belt that only runs when you put weight on it. Every step you take, every calf muscle contraction, every ankle flex squeezes those lymph vessels and pushes fluid upward. Stop moving, and the belt stops entirely. Sit for 3 hours, and the fluid just sits in your ankles doing nothing. When you're 30, this is not a serious problem. The lymph vessels are elastic. The valves inside them are tight and crisp. A single walk across the parking lot restarts the whole system within minutes. But after 60, 3 things change at once. The lymph vessels stiffen, the valves begin to leak, and the connective tissue around the ankles starts to lose its own elasticity. Fluid seeps out faster, and the system drains it slower. The math stops working, and the reservoir quietly grows. Before we go further, I want to draw a clear and important line. There are situations where ankle swelling is a medical emergency, and you need to recognize them. If one leg suddenly swells significantly more than the other within a few hours, and it's painful, warm, and red, that can indicate a deep vein blood clot. See a doctor today. If both legs are swelling and you're having difficulty breathing, especially when lying flat, or you're waking up gasping at night, that pattern points to serious heart strain. Do not wait. If swelling is accompanied by sudden weight gain of 4 or 5 pounds in a single week, combined with foamy urine, that combination suggests the kidneys may be losing protein. That needs blood work this week. And if swelling is one-sided, painless, hard to the touch, and you have a history of cancer treatment in that region, that needs a professional evaluation. If none of those describe you, if your swelling is gradual, symmetrical, worse in the evening, better by morning, and you have no breathing trouble at rest, then what follows is for you. There are 3 patterns of chronic lower leg swelling after 60. They look similar to the eye and have completely different causes. Pattern 1 is venous. Your veins are struggling to return blood to your heart. Valves inside them have failed. Blood pools, pressure rises, and water is forced out through the vessel walls. You'll typically see visible varicose veins and a brownish discoloration just above the ankle. Pattern 2 is lymphatic. This is the one we're focusing on today. Lymph flow has slowed. The tissue is saturated. The swelling is soft, leaves a pit when you press it, and often involves the top of the foot, the area just behind the toes. When this has been going on for years, the skin on the top of the foot becomes so thick you can't pinch it between 2 fingers. Clinicians call this a positive stemmer sign, and it points directly at the lymphatic system. Pattern 3 is cardiac or renal. The swelling is symmetric, worsens through the day, and critically, it comes with other symptoms: shortness of breath, waking multiple times to urinate, extreme fatigue, or rapid weight gain. If those companions are present, pattern 3 is not a home protocol, it's a doctor's office. Most people over 60 with chronic evening ankle swelling and no other symptoms fall into pattern 2, lymphatic. Let me tell you about a patient I will call Margaret, 68 years old, a retired school teacher. She came in convinced her heart was failing. For 2 years, her ankles had been thickening by evening, at first just slightly, then enough that she could no longer wear her regular shoes. She had an echocardiogram done. Her heart looked completely normal, an ejection fraction of 62%, healthy. She was given a diuretic. She took it for 6 months. She ran to the bathroom constantly, became exhausted and dehydrated, and her ankles barely changed. Then she said one thing that unlocked the whole picture. The strange thing is, when I travel and walk around all day, my ankles are actually better. That was the clue. Better with movement, worse with sitting. Her heart was fine. Her kidneys were fine. Her veins showed only mild age-related changes. What Margaret had was a lymphatic drainage problem, and no pill in the world could fix it because the fluid was never in her bloodstream in the first place. Here's what was happening inside her body every day. She would wake up, ankles thin, 8 hours lying flat, gravity not pulling fluid down, her lymphatic system slowly clearing the reservoir from the day before. Then she would get up, sit at the kitchen table, sit in the car, sit at her volunteer desk. By 2 in the afternoon, she had been mostly still for 7 hours. Fluid had begun to accumulate in her lower legs, a teaspoon at a time. By evening, the sock groove appeared. By 10 o'clock, she lay down, and then the real problem began. With gravity no longer holding the fluid down, it slowly reabsorbed into her bloodstream. Her heart received an unexpected flood. Her kidneys shifted into overdrive. She woke at 2, at 4, at 5 in the morning, exhausted, and the cycle began again. Let's run 2 quick tests right now. Test 1, the pit test. Find the bony ridge along the front of your shin, about 4 inches above your ankle. Press your thumb in firmly and hold it for 15 seconds. Lift your thumb and look. If there's a visible indentation that takes 10 seconds or more to smooth out, you have pitting edema. Grade 1 is a slight dent. Grade 2 is deeper and lasts longer. Grade 3 is a deep dent lasting over a minute. Write down your grade. You'll retest in 2 weeks. Test 2, the skin pinch. Try to pinch the skin on the top of your foot, just behind your second toe, between your thumb and forefinger. If you can easily lift it into a fold, your lymph is moving. If the skin feels fused to the foot beneath it and you can't lift it at all, that's the positive stemmer sign, and it points directly at the lymphatic system. Now, let's talk about what makes this worse, and most people over 60 do all three daily without realizing it. First, hidden sodium, not the salt shaker, the hidden stuff. Cheese, cured meats, canned soup, bread, condiments, restaurant meals, frozen foods. Sodium pulls water out of your bloodstream and into your tissues. Your body will retain roughly 4 cups of water for every gram of excess sodium. Most people consume twice the sodium they think they do. Second, sitting after dinner. The hours between 7 and 10 at night, when you finally relax, are exactly when your legs accumulate the most fluid. 3 hours of immobility after your largest meal of the day creates the worst possible conditions for overnight reabsorption. Third, alcohol. Even a single glass of wine in the evening dilates capillaries, increases the fluid leak rate into tissues, and suppresses the hormone your brain uses to tell your kidneys to slow down at night. One drink and your ankles will be noticeably worse by morning. Now the other direction, what actively supports lymph flow. Water. This is counterintuitive. Most people with swelling drink less because they assume more water means more swelling. The opposite is true. Dehydration thickens lymph, making it sluggish and difficult to move. A well-hydrated body has thin, free-flowing lymph. Aim for roughly half your body weight in ounces throughout the day, tapering after 5 in the afternoon. Foods rich in natural flavonoids, compounds that strengthen the walls of small blood vessels and reduce fluid leakage. The best sources are dark berries, buckwheat, citrus peel, and red cabbage. A cup of berries a day has measurable effects on capillary integrity over approximately 8 weeks. Protein. Low blood protein, specifically low albumin, is one of the silent drivers of tissue swelling in older adults. Albumin is what holds water inside your blood vessels. When it drops, water leaks into tissues and stays there. Many older adults are mildly protein deficient without knowing it. 2 servings of quality protein daily, eggs, fish, chicken, lentils, cottage cheese, directly improves the physics of fluid balance. And magnesium, which is deficient in most people over 60 and is involved in smooth muscle tone, including the walls of lymph vessels. Pumpkin seeds, dark leafy greens, and almonds are the simplest food sources. Now, the 5-minute routine that drains your ankles before bed. Every part matters. Pay close attention. In the morning, before your feet touch the floor, while you are still lying in bed, do 30 ankle pumps. Point your toes down, then flex them back up toward your face. 30 times. It takes 45 seconds. It restarts lymph flow after 8 hours of stillness and prevents fluid from rushing downward the moment you stand. During the day, every hour you are sitting, do 20 calf pumps. Heels on the floor, lift your toes upward and back down, or stand and rise onto the balls of your feet and drop back down 20 times, 30 seconds. Set a timer if you need to. This keeps the conveyor belt moving so fluid cannot accumulate. Before dinner, take 5 minutes of slow walking, not a workout, just movement, around the block, around the house, around the yard. Walking activates the deep calf muscles in a way that seated pumps simply cannot replicate. And now the critical piece, 90 minutes before bed. Lie on the floor or on your bed, place your legs straight up against the wall at roughly a 90-degree angle, heels higher than your hips, hips higher than your heart. Stay there for 15 minutes. During those 15 minutes, do slow ankle circles, 10 in each direction, then alternating ankle flexes, 20 repetitions. Then, while still in that position, place both hands flat on your abdomen and breathe deeply through your nose, belly rising, for 3 full minutes. Slow, controlled, deep belly breathing. Here's why that breathing matters. The thoracic duct, the main drainage vessel of your entire lymphatic system, sits directly behind your diaphragm. Every deep breath you take is literally pumping your lymph. This is not a metaphor, it is mechanics. After 15 minutes, slowly roll to your side, sit up, and do one final step. Starting at your ankle, use the flat of your fingers to stroke the skin upward toward your knee. Slow, gentle, always moving toward the heart, never downward. 10 strokes on each leg. This is a simplified form of what clinicians call manual lymphatic drainage, and it physically moves fluid from the tissues into the lymph capillaries. Shortly after completing this sequence, you will feel the need to urinate. You will release 300 to 400 milliliters of pale, clear urine. That's the fluid that otherwise would have woken you at 2 in the morning. You just drained it while you were awake and in control. Margaret followed this protocol for 3 weeks. By the end of week 1, her sock marks were gone by morning. By the end of week 2, she was sleeping through the night without interruption. By the end of week 3, her ankles at 9 in the evening looked the way they used to look at 9 in the morning. Her heart medications had not changed. Her prescriptions had not changed. What changed was that her lymphatic system was finally being given its work shift at a time that suited her life, instead of scrambling through the night while she tried to sleep. Here's what to do starting tonight. Do the PIT test right now. Know your grade. Write it down. Identify one source of hidden sodium tomorrow and remove it for 2 weeks. For most people, the biggest hitter is cheese, cured meat, or canned soup. Choose the one you eat most often. Before dinner tonight, not after, before, take a 5-minute walk. 90 minutes before bed, legs up the wall for 15 minutes. Deep belly breathing for 3 of those minutes. 10 upward strokes on each calf when you finish. And now, tomorrow morning, 30 ankle pumps before your feet hit the floor. Do this consistently for 2 weeks, then retest with the PIT test. The difference is not subtle. It's the kind of change you see in the mirror, feel in your shoes, and notice the first morning you wake up without pressing your thumb into your calf just to check. Your ankles are not betraying you. They're a drainage system that stopped receiving the signals it needed to function. Give it 5 minutes a day, and the change speaks for itself. If this explains something your doctor never had time to explain, share this video with someone who needs it. They've almost certainly been told it's their heart. You may give them the answer nobody else gave them. Subscribe to Secure Health for more evidence-based guidance that respects your time, your intelligence, and your right to understand exactly what is happening inside your own body. We'll see you in the next one.